everybody. So we are going to be learning about surface disinfection and barrier wrapping of a dental unit to prepare the unit for live patient care. So there's lots of steps to getting the unit ready. This process is outlined on pages 24 through 26 of your lab manual. So helpful to pull those pages out of the lab manual so you can take a look at the steps and follow along. But basically today I'm going to be going through this process so you all can see what needs to be done. Again, the objective is to prepare the dental unit for direct patient care. So to do that, we need to clean the unit. We need to look for any gross debris. So gross debris would be something more like dirt or something that might need to be washed off with soap and water before we actually disinfect the unit with the disinfection wipes. So the preparation is to complete obviously your beginning of the day hand washing, and then don PPE. Also want to have your clinic cart out and ready so we can pull any necessary supplies that we might need during the patient care process out for disinfection so that we can use those items during patient care process. I have my masks and gloves back here. It's nice to keep masks and gloves for students in the back of the unit. Then you can just kind of shove them in there and close this up so that they're not getting exposed to some of the aerosol production. I also have a bottle of hand sanitizer right here just to make it convenient. Off camera, we have hand sanitizer right by the sink, so there's lots of opportunities for hand sanitizer and hand washing throughout the clinic to make sure your hands are clean. I already did my beginning of day hand washing. Again, you wouldn't be able to see that because it's off camera, so I already went ahead and did that. I also went ahead and cleaned my operator glasses so that I can don my PPE. So we're going to start. Again, this process is done at the beginning of each day to prepare the unit for patient care and also in between any patients. So as you go through the program, you'll start to see multiple patients in a clinic day, and so this would be the process that you would use that you would do to clean in between your patients as well. So, and then first thing you're going to do is we're going to don our PPE. So again, I already did my hand washing technique. There's hand washing video. So if you haven't watched the video for hand washing, World Health Organization hand washing, please watch that. There's also hand washing signage at every hand washing station in the clinic, so you can see the steps for proper hand washing. Hand washing, we wash our hands anytime we come in at the beginning of the day from outside, and then anytime our hands get visibly soiled. Otherwise, it's okay to hand rub with hand sanitizer. Hand washing is going to take about a full minute, where sanitizing takes about 20 to 30 seconds. But we do want to make sure our hands are thoroughly clean. Anytime we're going into any of our drawers, cabinets, our cart to grab items. So always making sure we're going in with clean hands. So important to make sure we're washing hands or sanitizing hands before we put gloves on and then immediately after we take gloves off. Why would that be important? Well, gloves, protect us, but there is a level of penetrability. So when we take our gloves off, there could have been germs that penetrated through the glove. So we want to make sure that we're sanitizing or washing if need be. If you get a tear in your glove and you get something on you, obviously you want to wash your hands instead of just using sanitizer. So we're going to go ahead and get started with the process. So again, I'm going to start by doing a hand rub with hand sanitizer. So we got a 30-second hand rub, and you really want to work the sanitizer in between your fingers and really all the little cracks and crevices on your hands to make sure you're really working it into all the spaces. And it takes a few seconds for the sanitizer to dry, so sometimes we help it along. Okay, so now my hands are clean. I'm going to go ahead and grab the PPE that I need. I'm going to come over here and grab a gown. So when donning PPE, the first thing you want to put on is your overgown. So I got my gown. And second thing I'm gonna put on is my mask. Grab a face mask. And these face masks have a nice little flap that comes up that you can use to help kind of protect from any breath that might fog your glasses. So I'm going to put that on. So when you put your mask on, you just want to loop it around your ears. You don't want to crisscross the loops at all. You really just want to wrap it and loop it around the ear. Then you want to kind of press the nose piece so it fits securely. And then there is a little piece underneath the chin here that you can tighten up just so the mask fits really nice and snug and secure against your face. Just like so. Okay, so now I'm ready to put my eyewear on. So again, I already washed my eyewear with soap and water, so it's clean and ready to go. And then lastly, we're gonna put on our gloves. So I'm gonna go ahead and sanitize my hands again, just because I was pressing my mask into my face. I maybe touched my hair a little bit. Obviously, those are not things that are 100% sanitized, so I'm going to give a good hand rub again before I put my clean gloves on. And actually, before I do that, I'm going to grab out any of the supplies that I need from my cart. So I already have a clipboard and some pens out here. I'm going to disinfect those. And I'm going to grab my patient's over glasses, some disclosing solution, and a hand mirror, which I'll probably use for patient education. Okay, so I have all my items out now that I need. I'm going to do one more hand rub, and then I'll put gloves on. So we're going to be using Optum wipes. There's different types of disinfection wipes and cleaners. The Optum wipes that we use are a one-step process. It just needs to sit on the surface for 1 minute. So we're gonna wipe surfaces, and you wanna see that the surfaces are wet with sanitizer. I'm gonna go ahead and place my gloves on. Okay, and I'm going to turn my unit on and lower my chair down. You want to make sure that the rheostat is not tucked underneath the chair. The rheostat is the little foot pedal. Usually when you come in the morning, it should be sitting on top of the chair. And you don't want to lower the chair all the way down to the floor because you can crush some of the equipment and cords underneath. So lower it down to a good level where the patient can comfortably get in, where the back of the chair is kind of sitting at the back of where the patient's knees might be. The hand rest can be lifted and lowered. So there's that option. Okay. So I evaluated all of my surfaces for gross debris. If I noticed anything that was dirty, I can clean that with soap and water and a paper towel. So I'm not seeing really any dirty surfaces on the chair or anywhere else in the unit. So if that step's not needed, then you can eliminate that step. But if you do see some dirt or something that needs to be cleaned with soap and water, then that's what you would do before you actually disinfect your unit. Now, this happens all the time. So it's a good example, but I forgot an item that I need that's in a drawer. So now I have to deglove, go ahead and sanitize my hands again, so that I can make sure my gloves or my hands are clean before I go into the drawer to grab the item that I need. So I'm going to grab from the drawer here some 4x4 gauze squares. And we're going to use the 4x4 gauze with soap and water to clean the operator chair and the patient chair both, and the overhead light. So these things only get cleaned with soap and water, and we do not use the disinfectant wipes on them. The disinfectant wipes can break down the integrity of the chair covering. It can also smear and break down the material on the overhead light. So we're not going to use disinfectant wipes on those things, but we want to make sure that they're clean and ready for patient care. Okay, so now we'll start again. Clean gloves. Four by 4 gauze squares. I'm going to step over here, get them wet at the sink. Light soap, so just a little soap is all that's needed, or no soap at all. So either light soap or no soap. So now I'm going to clean the patient chair. The operator chair. Handles under the operator chair that we adjust the chair with. And then the overhead light. So just wiping the surface of the overhead light. Okay. So those items have been cleaned with 4x4 gauze squares, soap and water. So we can throw those out. And now we're ready to start disinfecting our surfaces in the dental unit. So again, with the Optum wipes, I'm going to go ahead and grab, I like to use 2 wipes at a time. And so we're going to disinfect pretty much all the surfaces in the unit, including the countertops. So I know I have my papers here, but I wouldn't have those here normally to clean the entire countertop. You're going to clean cabinets. So you're going to clean the fronts of the drawers, because remember, aerosol sprays 6 feet. So we want to make sure that we're wiping anything that we might touch during our procedures. And if my wipes start to get dry, then I'll just grab new wipes. So wiping off all of this would be the saliva ejector and then the hoses as well. When we wipe hoses, we want to hold on to the top of the piece where it connects to the hose, and we want to wipe the hoses moving in an upward direction. Then we're going to wipe the holders. And then again, I like to use the 2 wipes so that I'm holding it with one hand, wiping with the other, and then once I wipe the holder, I can place it back into the holder with clean. Same with the HVE, the high vacuum. I lost my saliva ejector. The control panels, the air water syringe, and sometimes the hoses get a little tangled up. Again, wiping in that upward direction, wiping the holder. This is our HVE for the leaf. Again, wiping those hoses, wiping the holder. Okay, so now we've disinfected the back rear delivery system, but my Optum wipes have dried out, so I'm going to throw those away and get a couple new wipes. All right, now we're going to wipe off the back counter. The front of the cabinet, the back of the top of the cabinet, our supplies over here, the top of my cart, front of the cart and the drawer handles, patient glasses should be cleaned with soap and water. So these were cleaned ahead of time, but you can always wipe the sides. Disclosing solution. Wiping the fronts of the patient glasses can also harm the coating on the glasses. So you just want to check the manufacturer's directions for what you can use to clean those. And then my mirror. And then for the front of the mirror, you'll probably want to use soap and water if it gets anything on it. If we're going to be using the power scaler, we'll open this cabinet, pull this out, and wipe everything off here, including the handpiece cord, the tray where the Cabotron sits, handpiece holder, the power button underneath, and then it can sit and wait until we're ready to bury or wrap it so we can tuck it back in there knowing that it's clean. The fronts and the drawers and the handles on the back of the unit. We want to open up the back here and wipe down the water bottle. And if you're going to be using the power scaler, you can pull out the power scaler pedal, wipe that off as well. When you're messing around in the back with all of these cords, you just want to make sure these cords are not getting pinched in any of the drawers. So be mindful of the cordage at the back of the unit and make sure there are not any cords that are being pinched. Okay, so everything's been wiped off. In the back, we got all our cupboards and cabinets wiped off over here, but we still need to disinfect the front of the unit. So, air water syringe holder, wiping up so that it doesn't impact the coupling here, where the coupling meets the hose. So you hold onto the coupling and then you wipe the hose in the upward direction. Wipe the holder, drop it back down, and then the same thing for each of the hand pieces and hoses. Okay, got the front of the unit. We're going to wipe the water bottle at the front of the unit as well, in case we need to change that and add water. All right. So, well, let me take a gander. Oops, make sure I didn't miss any steps. We can also wipe the sides of the light, the handles on the sides of the light, and then also where the button is to turn the light on. Okay. I think that covers it. Let me just take a look. We got the clinic cart top, the power scaler, the air water syringes and water bottles, the handpiece supply hoses at the front and the back, the HVE saliva ejector, the light, the countertops, cabinets and drawer handles, and then we wiped all of our auxiliary items that we pulled out for patient care. So everything's been disinfected and is clean. So now I can remove my gloves. So to remove my gloves, I'm just going to grab my glove and pull it that way from the outside in and then throw away. What do I need to do now? I need to clean my hands again because there may have been some contamination. Okay, so now with clean hands, we're going to barrier wrap this unit. So with clean hands, I'm going to grab the barriers that I'm going to need. So all the barriers are in the cabinet. So I'm going to grab a chair cover and we're going to cover the chair, patient chair. And we're going to cover the operator chair. And if we're doing assisted hygiene, we have a dental assistant helping us chairside, we'd also want to barrier wrap the assistant chair. But I'm not going to do that for today just to save a barrier. But this is nice. This makes it nice because when the instructors come in to check your patients, a lot of times we have to grab the back of the chair to move it. That just helps protect that chair from anything that might be on our hands. Okay, we have tray covers. So we can use a tray cover here at the back. If you want to use a tray cover here at the front as well, you certainly can. But a lot of times we're just using our instrument sterilization packet there, which works just fine. All right, the keyboard and the mouse, we're going to pull that out here. We're going to want to cover those and also the monitor. So here we have a keyboard cover. This one, the keyboard covers also have a little pouch here at the top that can be used to cover the monitors. So we can cover the monitor that way. We might grab onto these hand rests to move this monitor around, or this handle at the front. So I have blue tape here. We like to try and minimize our use of the blue tape because it's kind of pricey. But I can put some blue tape there. And you can also put blue tape here to cover the light switch. Also use tape here to cover my chair handle adjustments, because when the instructor comes in, they might need to adjust the chair height a bit. So I'm going to cover those so that if they need to adjust with contaminated gloves, they can do so. I could use tape over here as well, or on the side, but I'm going to use a different barrier for that. Alright, so syringe sleeves can be used to cover the light handles. We do have some left-handed instructors as well, so it's good to cover both sides of the light handle. So there we have our barrier wrap there. Excuse me, touching that. Alright, for the front and the back of the unit. So for the front, we cover our monitor again. Obviously I'm out of practice. This is just a chair cover that I'm going to use. to cover the front of the unit. So you can kind of tear up these chair covers on the side sometimes, like so, to make it a little bigger, and then you can use that and spread it over the top of the unit itself. And then these can be pulled out for use. If you want to use syringe covers for the handle here, you can. That way you can grab onto this handle a little bit easier with it being covered, like so. And then we're going to leave one of these here for a syringe, one of these here for the back, and then also grab a chair cover. For the back unit. So same thing, kind of spread it out, then you can tear it, and then I can use this to cover my back hoses. Then I can pull these out, like so. The ones I'll be using. Cover for my keyboard. I like to use the tape for the mouse. And this tape's really sticky, so I like to do like a little fold. That way you can have a spot where you can kind of pull the tape up off the mouse if you need to. So there's our keyboard and our mouse. Still need to cover this back tray. I'm gonna grab another chair cover. And I can spread that out to cover this back table. Okay. So everything pretty much has a barrier on it now. Let's see, did we miss anything? For your pens, there's two options for pens. Well, there's probably three options for pens. There are these little blue finger cots. You can use a syringe cover, which is probably a better option. These finger cots have latex in them, so if your patient is latex sensitive and you're touching your pen and then touching their face, that won't be good. So yeah, if you want to stick to the syringe cover, that might be a better option for the pen, but you can just kind of insert the pen. There's a little slat opening there, and then you have a cover on your pen so that you can grab your pen and use it for writing without contaminating the pen. Because if contamination gets into these little cracks and crevices, it's pretty impossible to clean and disinfect that. So that's one option. Or you could use the finger cot, and this one just kind of rolls onto the pen. So stick the pen and then you just kind of roll it down. So that's an option. You have to break the end so that you can use it for writing. Or you could use the blue tape and wrap your pen or pens in blue tape. Okay. Like so. Let's see. Like so. Just wrap it around so then you have it covered. So those are your options there. As far as the cart, top of the cart goes, we can also use a chair cover or chair covers either to cover the top of the cart. Like so. Okay, now I'm going to grab some supplies from the drawers that I'm going to need, like air water syringe, like high vacuum suction tip. So in the drawers at the back of the unit are all the supplies that you will need. But again, you want to make sure you're going into the drawers with clean hands. Well, I haven't touched any contaminated surfaces because I've been going into the drawers and we cleaned all the outside of the drawers and handles, so my hands are still good. So I'm going to grab a cotton tip applicator. I might need this to apply lip lubricant, and I might need it for my disclosing solution. I have a saliva ejector and the little backflow valve that prevents backflow when patients close around the suction tip. So I'm going to push that on there. Now I can put that onto my saliva ejector. I'll take one of my barriers here, and that can go over the top. Again, we want to keep these things covered because these little levers and handles where there are cracks and crevices, they're hard to clean and disinfect. I'm going to grab an air water syringe, attach that here. So this just is going to slide in, and then I can tighten the nut down to secure it into place. And then I can put my cover over that. And then we're going to grab a couple gauze squares that we're going to need. We probably need more than that for patient care, but I'm just going to grab a couple so as not to waste them. A little small dapping dish that you can put disclosing solution or lip lubricant into. And a high vacuum suction with the backflow valve. So that will fit into there. And then I can attach this to my high volume suction, just like so. We really only use the high volume suction when we're doing aerosol production procedures, just to help minimize the aerosols. So you may not be attaching that and using that for the first few weeks, but just to get in the habit of having everything out in the way you want it, you can do that. If you want, you can also attach an air water syringe to the front, just in case the back one's not working or you decide to use the air water with your right hand and the suction with your left, or vice versa, depending on your handedness. Okay, so everything's barrier wrapped, everything's clean. I got my supplies out, and it's pretty much ready to go. Of course, if I were going to be using my power scaler, I would have that all out and set up. And it's always good to have your packet of instruments ready and out on your tray. So ideally, anything that I might need during my patient care process, I would want to have out. Blood pressure cuffs, stethoscopes, those items, if you're going to leave them out, you just want to make sure that they're covered. So, for example, if I had my lab manual out here and maybe my stethoscope and blood pressure cuff out on this counter, that's fine. You can have items set up out on this counter, but just remember, we're going to be doing aerosol production at some point, whether we're doing it with the air water syringe or with a power scaler. So good to have your items over here covered with plastic, just again, so they're not getting aerosol on them. If there are open drawers or cubbies that you can tuck your items into, you can certainly do that. A lot of these drawers have items in them, so you have to kind of look. You can also tuck your items kind of underneath on the top over here on the side, or in the back here. You can always kind of hide some of your items back here to keep them out of the way of aerosol production. So I think that was about everything. Hopefully that was educational and informative. I suppose I can do a doffing PPE. Let's see. So I already removed my gloves and you saw how I did that. So when you're taking your PPE off at the end of the appointment, or if you have to walk out of the clinic to go to the restroom or anything like that, the first thing you remove is your gloves, right? So you saw how I rolled those off and removed those. The next thing you do is sanitize your hands or wash or clean your hands before you touch anything on your face, right? Because you could have contamination and you don't want to spread that to your face, your head. So my hands are still clean. So I'm going to go ahead and remove my glasses. Now that these are glasses that I wore through the patient care process, they probably have spatter on them, so technically they're contaminated. So generally what we do is we remove them, bring them over toward the sink area because they need to be washed with soap and water, and set them on a paper towel over on the sink area because I'm going to come back and wash those for my next patient or for my next use. Next thing I'm going to do is remove my mask. So I'm going to go ahead and take my mask off just like so, just kind of trying not to touch the outside of it as much as possible. And the next thing I'm going to do is remove my gown, right? So we always change our gowns in between patients as well as our masks and our gloves. So now that I'm done, I can just kind of break the tie back there. You want to roll it down because, again, the outside of it is contaminated. And then we can roll it up and throw it away. Now my hands are dirty, so I'm going to sanitize my hands again using the handy dandy sanitizer that's right there. Okay, that's it.